Hi, this is Grdds. I am working as an assistant professor in Kokandan Peter Aldarkar College of Pharmacy and Research Institute. Today I will let you know what is meant by gastroretentive drug delivery systems. So gastroretention is done for mainly the drugs that absorb from the stomach like levodopa furosemides, acting locally in the stomach like antacids, anti-ulcers and enzymes, antibiotic therapy, and poorly soluble at alkaline pH like diazepam, salbutamol, degrade in the colon like captopril, ranitidine, metronidazole. Drugs that are having narrow window of absorption, that means the drug which are absorbed from specific part of the stomach. Gastroretention is unsuitable for the drugs that are having limited acid solubility like phenytoin, unstable in gastric condition like erythromycin, and the drugs which undergoes extensive fast metabolism. Factors affecting the gastric retention of the dosage forms are density, size, and shape of the dosage forms. There are various advantages of using this gastroretention drug delivery, like we can get the improved drug absorption because of increased gastric residence time and more time spent by the dosage form at its absorption site. Controlled delivery of the drugs, we can minimize the mucosal irritation by releasing the drug slowly at control rate. Treatment of gastrointestinal disorders like gastroesophageal reflux and providing the local action, ease of administration and better compliance. There are various limitations of using gastroretention drug delivery system, like retention in the stomach is not desirable for the drugs that cause gastric lesions like NSAID drugs, the drugs that are degraded in acidic environment of the stomach like insulin, the drugs that undergo significant first-pass metabolism like nifedipine, drugs that have very limited acid solubility like phenytoin. There are various approaches for the gastric retention, means it can be divided into various types like floating drug delivery system, mucoadhesive system, swallowable system, and high density systems. So what does this means? It can be clear from this image. Floating system means that remains float onto the gastric content, float onto the surface of gastric content. Mucoadhesive system means which remains adhered to the mucosa of the stomach. Swelling system means which is having very less size at the time of administration and it gets swell after some time. And high density system means which gets sediment at the bottom of stomach. Floating system. Further, this floating system mainly classified into effervescent system and non-effervescent system. Effervescent systems are further classified as gas generating system and volatile system. Non-effervescent systems are further classified as single layer floating tablet, bi-layer floating tablet, alginate beads, and hollow, or that is also called as floating microspheres. Thank you very much guys. This was all about the gastric retention time. Thank you very much.